reduced to how by effective, affordable, and acceptable maternity care. So it is very much effective. It has to be most effective. Health assessment should be there, and also the care should begin in the early pregnancy, and this care should continue at the intervals also. So we will see in further things how this care is being taken and what all things to be kept in mind. So coming to the antenatal care, what is it? It's defined as periodic and regular supervision, which includes the examination and advice of a woman during the pregnancy. It is called as antenatal care. So this name itself, the term itself is saying it's a periodic. So every month or every 2 months, the woman has to go for her supervision or for examination. Okay, so the care which is given during the antenatal period is called as the antenatal care. Also, it is the supervision should be at a regular and a periodic nature in accordance with need of the individual. So if it's a high risk case, obviously she cannot go only for 2 months once or just a 4 visits in the whole antenatal period. It may be she may require to go every month for the periodic supervision or for the assessment. Okay, so what are the aims of this antenatal care? It is to screen out the high risk cases. So when the mother comes for the assessment for the antenatal period to the hospital, so when we do all the assessment, all the blood, all the lab investigations, so we get to know whether the woman is under high risk or she belongs to a normal case. So to prevent or to detect and even to treat at the earliest any sort of complication that may cause complication in the labor as well as in the puerperium period also, and even to the newborn also. So to ensure continued medical surveillance as well as any sort of prophylaxis needed. To educate the mother about the physiology of pregnancy and labor by demonstrations of the charts and diagrams, so that whatever the fear she has or she has heard from any of her relative or any of her sister or friends, so that can be removed and even her psychology can be improved. As a antenatal mother, she's very much receptive when she's pregnant. Once when she's in labor process, if you're trying to explain her what to do and what not to do, it will be very difficult for her to cope up that time. So it is very important that she should be educated regarding this during the antenatal period itself. Continue to discuss with the couple. So here it is not only the mother or the woman who is pregnant, obviously it is the husband also. So we have to discuss anything with the couple about the place of delivery, time of delivery, and mode of delivery. Suppose if she belongs to an high risk case, so it is very much important that we should explain the consequences of normal delivery as well as what are the plus points or what are the pros for the cesarean section provisionally and care of the newborn also. So to motivate the couple, the need of family planning, that is also very much important during after the delivery of the baby. So we have to motivate the big couple regarding the need of family planning. To advise the mother about the breastfeeding, postnatal care, and immunization. This is also very important because we have seen in hospital that women they land up into they do not begin or they do not initiate with the effective breastfeeding. So it is important to educate the antenatal mother regarding the techniques of breastfeeding, how to take the care of the baby, and what all immunization should be given to the baby after the birth and later on also. So coming to the objectives of antenatal care, to ensure a normal pregnancy with delivery of an healthy baby from a healthy mother. So this is the main objective of the antenatal care. What are the services? So as per WHO, it recommends that at least compulsory antenatal mother has to visit 4 visits. So the first visit around 16th week, second visit around 24th to 28th week, third visit at 32nd week, and fourth visit at 36th week. So these are the compulsory visits that she has to go during the antenatal period. Yes, of course, as it has been mentioned earlier also, if she belongs to an high risk case, the doctor may recommend her to come on every monthly basis for the assessment. So now be coming to the main topic, that is antenatal care. So this antenatal care, it comprises of registration of the pregnancy. It is very much important. Okay, and next is the history taking, because once the first times when the woman comes with pregnancy, we have to take her complete proper history. Antenatal examination, which in which we have the general as well as the obstetric examination, lab investigations, and the antenatal advices. So the antenatal care comprises of these all things. So we will be discussing this in detail now. So coming to first part, that is assessment and the physical examination. So what is the main goal over here? To reduce the maternal as well as the perinatal mortality and morbidity rates, to improve the physical as well as the mental health of the pregnant woman, to prepare her for labor, lactation, as well as care of her infant. That is very much important. To detect the early and treat properly any sort of complicated conditions that could put the mother as well as the baby into the danger, which may also impair the health of both also. So coming to the definition of the antenatal examination, it is a planned examination and observation for the woman from conception till the onset of the labor. So what is it? It's an planned examination. So the whatever the examination we carry out, it is an planned, and it should be a proper observation of the woman from conception, from the moment she is pregnant till the onset of the labor. So this assessment, the initial assessment begins with the interview. That is, you're going to talk to the mother and establish a trusting relationship. Unless and until you develop rapport with the woman, she will not be completely opened up in front of you people. So it is very much important to establish a trusting relationship between the nurse and the pregnant woman, and to establish rapport, to get information about the woman's physical as well as the psychological health, and also to obtain a basis for anticipatory guidance for the pregnancy also. Okay, so during the first visit, assessment and physical examination must be completed, which includes history, physical examinations, all the lab data, her psychological assessment, and her nutritional assessment. So we'll be seeing this now. So coming to history, we have to welcome the woman and ensure a quiet place where she can express her concerns and also anxiety without being overheard by the other people. So we have to maintain her privacy. Collecting the client data or woman's data or profile, her name, woman's name, her age, her occupation, address, and her mobile or her contact number, marital status, whether she is married or unmarried or divorcee, duration of marriage, that is very much important. So we have to ask her the duration of marriage, religion, nationality, and language. Why language? Because it is easy to have a conversation and develop proper rapport. Housing and finance also. Then coming to the identification of the chief complaints. So what do you mean by chief complaints? With what complaints the woman has come to the hospital. So you have to ask her if she has any current problems, like, but because as we all know that at the beginning, or if she's a primary mother, obviously she'll be having the morning sickness, which is nausea and vomiting. So we have to ask her whether she has nausea and vomiting, any sort of abdominal pain. Okay, whether she's having headache or any urinary complaints, because certain times women may have UTI also during the first trimester. Okay, if she's having any sort of vaginal bleeding, certain small spotting, it's okay, but if she's having a continuous spotting, so that is bit concerned. So we have to ask her regarding the vaginal bleeding, edema at the pedal edema, or certain times even at the vulva also. Certain times the woman will be having edema or periorbital edema. Backache is because the woman experiences during the antenatal period backache. Why? Because of the ligaments are being relaxed. So because of that, the woman may experience backache. Heartburn is there. Why? Because the esophageal sphincter, it has been relaxed because of the effect of the hormones, that is progesterone and estrogen. So because of that, mother may experience, or the woman may experience heartburn or regurgitation. Constipation, this constipation is because of because of the effect of the hormones. Coming to the menstrual history. So it is very important that in your history collection, you have to even collect the history of menstrual. Okay, so you have to ask her a complete menstrual history, like it includes LMP. LMP is the first day of the last menstrual period, because with that we are going to calculate the EDD. age of Minaki, which age her menses has been started, whether the Minaki or whether the menses is regular, and what is the frequency of the cycle. Frequency of cycle, whether it is 30 days, 28 days, 40 days, what is the frequency of the cycle, and you have to ask. And more importantly, you have to even ask whether they are using any sort of contraception method. Certain times what happens, they will not be using also, and they will not be having knowledge also. So you have to ask whether are they using. If they're not using, you have to ask whether they know regarding the contraception methods. Any previous treatment or menstrual problems, if the woman has any problems with menstruation, so whether she has undergone any treatment, so that should be collected, that history should be collected. And we have to calculate the EDD, that is how do we calculate. This is the Nagel's formula, which is we will have the first day of the last menstrual period. Either you will minus 3 months, okay, or you will add 9 months, or and add 7 days. So that will give us the EDD. So for example, if the calculated EDD of LMP was August to 30, 2024. So what will be the EDD? You're going to add 7 days, as August is a 31 days month. So you're going to add 7 days over this and add 9 months. So it will be, what will be the EDD? 6th June 2025. Okay, coming to the more important history, that is the obstetrical history. This is very much important because it is going to give us an overview of the previous pregnancy that may alert the care provider to possible problems. Okay, so that we can even understand what possible problems may arrive in the present pregnancy. So what are the things we have to collect in the obstetrical history? Her gravida. Gravida is how many times she was pregnant. Her para, how many times she has delivered or pregnancy after 7 months. Abortions, any history of previous abortions. Either it can be an spontaneous abortion or an MTP of the mother, or the couple has not do not want a baby, so they have undergone MTP. So that history and number of living children. Weight of the infant at birth and length of the gestation. Previous length of the gestation, whether it was a term, preterm. So that we have to ask. Labor experience, type of delivery, location of the birth, whether it was an home delivery or it was an institutional delivery. Institutional delivery, maybe we have to ask whether it was at the PHC or at the sub center or at an tertiary care center, and type of anesthesia used if she has undergone cesarean. Maternal and any sort of maternal and infant complications if it has been arised, that we have to ask. So coming to the next is the family history. So this provides us an information about the general health of the family, and also it reveals certain patterns of genetic or any sort of congenital anomaly. So this includes diabetes mellitus, hypertension, heart disease, cancer, or any anemia. Next is the medical and the surgical history. So chronic conditions like diabetes mellitus, hypertension, any sort of renal disease also can affect the outcome of the pregnancy and must be investigated. So these all history we have to take. So prior to the operation, if the woman has been posted for cesarean section, so prior to that we have to ask her whether she has any allergies to any sort of medication, that also should be documented. And any previous operation such as cesarean section or any sort of genital repair and cervical encirclage, accidents which involves injury to the bony pelvis. This all history, it will help us to plan her labor properly in the future. Okay, now coming to the physical examination. So physical examination, it is also very much important. It detects the previously undiagnosed physical problems which may affect the pregnancy outcomes. Also to establish a baseline level that will guide the treatment of the expectant mother and as well as the fetus throughout the pregnancy. Preparation of the woman. So explain, so that explanation is very much important so that we can relieve the anxiety of the mother. Suppose if she's a primary mother, she must not be ready for everything, so we have to explain her each and every procedure what we are going to do. Okay, and even verbal consent has to be obtained from the woman, whether we can assess her abdomen, whether I can assess her breast. So everything you have to take an verbal consent from her. Ask her to empty the bladder, because if it's a full bladder, it may hinder the antenatal assessment. Collect the necessary articles near the mother. Wash your hands before and after the Provide privacy. Provide privacy is very important, okay, because we are going to expose her abdomen as well as her breast also. So we have to provide her proper privacy, and we have to expose only the needed area. Hello? Any problem? Ma'am, am I audible?
Yes, ma'am, we can hear you, ma'am. We can continue.
Okay, okay, sorry. Okay, thank you. So we have to
Hello.
expose only, yes, yes, thank you. Expose only the needed area. Okay, so examine for the general appearance. Okay, it should be started from the moment the woman starts walking into the examination room. So because you can understand by that what is her gait. Okay, so you have to examine her from the moment she is entering into the examination room. Then observe the woman for her stature and the body build as well as the gait also. So you can see in these two pictures a woman who has been bent backward. It's a poor stature which will obviously put pressure over her lumbar region or lower back, and that may lead to back pain. But this woman is standing straight, and that is the good posture. Face is also observed for the skin color, whether it is a paler or there is any sort of pigmentation. Also, that is the clausma. Observe the eyes for edema of the eyelids and color of the conjunctiva. Healthy eyes are obviously it is very bright and clear. Okay. So wait. So this is very much important, as you also know. Even if we are going to the any sort of clinic or any sort of hospital, the doctor asks us to weigh our weight first. Okay, isn't it? So that is very much important over here in the antenatal period also. So an initial weight is needed so that to establish a baseline for weight gain throughout the pregnancy. So we can understand whether the woman is has gained weight throughout the pregnancy, or she is decreasing, her weight has been decreasing. So it is very much important that the initial weight to be checked. So the ideal weight gain during pregnancy, it depends upon the body mass index, that is the BMI, before she has been conceived. Okay, but whereas if she's expecting twins, it becomes particularly too important to gain more and correct amount of weight, because what happens, twins are prone to have, or they can be preterm delivery also. So it is very much important that her weight should be gained in a correct amount. If her BMI is of 18.5 to 24.5, that is an average BMI or average weight. So before conceiving, she should ideally have a weight gain between 11 and 16 kgs. So after conceiving, her weight gain will be ideally from 11 to 16 kgs. For the optimal growth of a baby, she should gain around half kg to 2 kg in the first trimester. So as we know that during the first trimester the weight gain is very slow, because women experiences nausea, vomiting, heartburn. She'll be having morning sickness. So because of the effect of the hormones. So that period, it is very, what we say, it is a dirty period. So that during that period the woman does not gain weight. Okay, but she has to gain at least half to 2 kg in the first trimester, and about 2 kg after that for the rest of her pregnancy. If she is pregnant with twins, she should gain almost around 18 to 23 kgs. Okay, it's a double. So what is the distribution of the weight gain, extra weight during pregnancy? The baby will account for around 3.5 kg of her extra weight. Okay, rest of the extra weight is because of the placenta. Okay, we know that placenta also is having weight. Amniotic fluid, okay, which is around 1 to 1.5 kg. As we all know, during the pregnancy, the breast tissues are also getting increased, isn't it? The size of the breast is increasing. So that weight also corresponds to the weight gain during the pregnancy. There will be increased blood supply. Why? Because the baby requires blood. So that is 2 kg, and obviously she requires stored fats also. The stored fats also will account for around 2 to 4 kgs, and the increased size of the uterus. As we know, the non-pregnant uterus is just a pea shape, which is around just 40 to 50 grams. But during pregnancy, it increases to around 1,000 grams. So it is around, so the even the uterine size has been increased. Then height and weight. Weight lower than 45 kgs or height under 150 centimeters is associated with preterm labor and low birth weight infant. Okay. So weight higher than 90 kgs also is not good. That means वजन कम होना भी ठीक नहीं है and वजन ज्यादा होना भी अच्छा नहीं रहता है. So if the woman's weight is around 90 kgs, which is associated with increased incidence of gestational diabetes, PIH, even cesarean section and postpartum infections also. So recommendations for weight gain during pregnancy are often made based on the woman's BMI. Okay. Next, coming to the vital signs. This is also a very important aspect when we are doing the physical examination or antenatal assessment. So every time woman's blood pressure has to be assessed. Why? Because it gives a baseline. Suppose later on in second trimester, if her blood pressure has been increased, so we can compare it with the baseline, with the initial assessment. So in late pregnancy, raised systolic pressure of 30 mm of Hg or raised diastolic pressure of around 15 mm of Hg above the baseline values at least on 2 occasions of 6 or more hours apart may indicate the toxemia. So what are the toxemias? Toxemias are like PIH, preeclampsia and all. Okay. So pulse, the normal pulse rate is around 60 to 90 beats per minute. Tachycardia also is associated with anxiety if the woman has history of hyperthyroidism or any sort of infections. So normal respiratory rate is 16 to 24 beats per minute. Tachypnea may indicate respiratory infections or cardiac disease also. Temperature, normal temperature during pregnancy is 36.2 degrees Celsius to 37.6 degrees Celsius. Even increased temperature suggests for any sort of infections. So coming to the head to foot examination. So skin, we have to check for the paler. Okay, if the paler skin, that may it indicates anemia. Even jaundice may indicate hepatic disease. Okay, you can see in the picture, the woman's skin is so paler. Even her conjunctiva is pale, isn't it? And on we have to check for the any integumentary, what integumentary changes are occurring. So you can see this, these are the clausma, which is that is a pigmentation which occurs over the cheekbones or certain times over the chin also, nose and the forehead. These are all temporary, these all vanishes after once the woman delivers. Okay. And in this picture you can see a line, that is the linea nigra. It is a dark color line which starts from the symphysis pubis, crossing the umbilicus to reach the Ziffy sternum. This is the linea nigra. Okay, linea nigra. You can see evidently in women who are pregnant. Even this shades off after the delivery. And striae gravidarum. You can see these are the stretch marks. In general term, we call it as stretch marks. So these striae gravidarum are pinkish in color. It is pinkish in color. So if the woman is she's an multi mother, then you can see the previous pregnancy scars also. Okay, that is called as striae albicans, which is silver in color.